Everyone, and I hope you are not bored yet. So I'm the last one, so I will try to be fast and clear. So my name is Evelina Ginevičiūtė, and I am from small but beautiful country, Lithuania, and I'm oral surgeon. And I cannot start my presentation without saying thank you for my mentor, for my teacher, for my friend, Professor Tomas Linkevičius. And after 10 years, we are still together and we are the best team. So thank you one more time. And now let's bring you back to one memorable Monday morning. It was about 3 years ago. I was in my office when I heard someone screaming and shouting, "Help me, please, I cannot sleep, I cannot eat, I'm drinking only medicine, so help me." And it was my godmother. So I cannot say for my godmother, wait or come tomorrow. So we made examination, and after this, we noticed that the problem is upper first molar. So in the X-ray, you can see that we can suspect something apically, but not something very dramatic. And after CT scans, we see that she really had pain, because we see how big inflammation we have apically, and the infection already resorbed all bone apically and even sinus floor. So we decided to remove this tooth. And after removing what we had nothing. We had really just a big hole without any bone apically. So you can see how easily we can go to the sinus straight from the mouth. So we had about, I don't know, more than 1 millimeter of communication to the sinus. So what next? What next? What we have to do now? So I asked this question for my colleagues, asking, so what would be your treatment plan for this case? And majority of them answered that I will suture the socket and I will make the late implant placement. Other colleagues said, I don't know, I don't care, I will send it to the surgeon and he can do whatever he wants. And I'm not surprised, because I also was learned in the university that if we have communication with sinus, and if we have so big communication with sinus, so the gold standard of treatment is to close this communication with different flaps designs. So you can see here, for example, it's flap from the palatal, and you can see how big, how difficult, how painful is this operation for patient. For example, patient will be thinking about you 2 weeks more after this operation, and it can cause swelling, hematomas. So it's really traumatic operation. And here you can see another flap design. It's from the buccal side. And I'm not saying that it's not working. It works and works very good. But what we have after healing, and we have nothing. We have zero bone. I'm not talking even about soft tissues here. And if we want to have tooth here in this place, so we have to make sinus elevation, bone augmentation, surgeries with soft tissues, implant placement. So these operations are also big, painful for patient, and it lasts. It lasts maybe for 1 year. And I love my godmother, but I didn't want to have here in my office for 1 year every day. So what I did, I made immediate implant placement in this case. And I'm very happy that already there are a lot of cases, a lot of studies about immediate implant placement, that it's safe treatment. For example, in this study is saying that immediate implant placement has more than 98% of success rate. So it's really successful treatment, and we can believe it in it. So we can go back to our case. And I think that a lot of us knows that if we want to have successful immediate implant placement, so the most important factor is primary stability. And how we can achieve here primary stability when we have zero bone apically. So the answer is very simple. It's white implant. And I know that there is also different opinions about white implants, because a lot of doctors are saying, do not use white implant. You will have failure. You will have big bone losses, especially in buccal plate. But I don't agree, because also there are a lot of cases with white implants. For example, in this study, you're saying that after 7 years, so it's quite long period, 7 years with white implants, we have only 0.19 millimeters of bone loss. So it's just nothing. So I can say one more time that we can and we must use in some cases white implants, and it will be successful. So we can go back to our case. So how we started. So we placed collagen membrane apically, and it was working as a barrier between sinus and the mouth. Then we placed the implant, white implant, in the socket, and it's immediate implant placement. So when we are doing immediate implant placement, so we are always doing bone grafting for soft tissues, to maintain soft tissue. So this case was not an exception. So we made bone grafting, and as you can see in the photo. And now also very important step, if you want to have not only successful immediate treatment, but also aesthetic, so you have to make individual healing abutment. So we managed to have a good primary stability here. It was about more than 50 newtons per centimeter. So we made healing abutment from composite and put it on the implant. So what we have after 2 weeks, so we still have implant in our mouth, but look how nicely it's healing. Look at the soft tissues, look at the contour, look at the bone. So it's good. And what is more very important, that patient had no pain, no complaints, no swelling, no sinusitis, and even no nose running. And after 4 months, only 4 months, and operation lasts only 40 minutes, we have results like this. And this is the buccal view. So we managed also to keep papillae here. And now I know also that a lot of doctors are saying that composite is not good for soft tissues, that we have very good materials like zirconia, like titanium for healing abutments, but even composite, if you are using it good, works perfectly. And here you can see articles about this that is saying also the same. Use correctly composite and it works. And this is outcome after 4 months when we take off our healing abutment. And I'm repeating, but again, look at the contour and look at the soft tissues here. And this is occlusal view after just 4 months. So we managed to have implant, we managed to save contour, soft tissues, and bone. So what we have to make now, just to make a final crown, and we made it from zirconia, super polished zirconia. And this is delivery day. This is a final outcome. And I even don't know what to say here because it looks like natural tooth just after 4 months. And this is the view from the buccal side. In the X-ray, we see that implant is fully integrated, white implant, and without any bone losses. So maybe you can say that it's just a 4 months, so it's a short period, but even after 4 months, we have results like this. But how it looks after 3 years? And I can say that after 3 years, we have even better soft tissues. You can look here, and we have fully completed papillae here. So after 3 years, the results are even better with this operation. And I also want to remind you all steps. So look again at the first day and the contour at the soft tissues and after 3 years. So it's completely almost no changes. And maybe you want to look at the CT scans. So after 4 months, yes, we have implant, we have some bone around the implant. And after 3 years, look at the quality of the bone. And I want to remind you also that we didn't have bone here at all. And now we have everything here. And what is also very important, no changes in the sinus. So how we can make this case better nowadays. Maybe we can have some more soft tissue friendly materials. And yes, we have. Yes, we have now. It's anatomy healing abutments from titanium. And if you do not like composite, if you don't know how to use composite, so use titanium anatomy healing abutments. And as you can see in this case, it works also perfectly and good, and you can be calm. So in the end, I want to ask you, so what would be your choice for your godmother to take this big, difficult, painful, costly, long-lasting operation, or 4 months and result like this? So this is my godmother smiling after operation and saying thank you for me. I'm saying thank you for you. And I want to end with one sentence that always do what you're afraid to do. So thank you.
Recording stopped.